You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast. And I have one of my most special returning guests today because there have been some changes that do need to be observed within dental practices around Australia. So please welcome back Dr Roslyn Franklin of Amalgamate Consulting. Welcome, Ros.
Hello, good morning, Julie. Thank you for having me back. It is always a pleasure.
Oh, you're delightful and glorious. And it is my pleasure to have you here. And I think it's going to be in the benefit for all of these dental practices because there has been a change to the Australian standards, that document that we all use in figuring out what we need to do in our stereo rooms. And not everyone will know that there's been a change. And even if they knew that there was a change and they read the document, it doesn't mean that we understand it.
Oh, very much so.
So tell us, Ros, what is going on with the Australian standards?
All right. So 18 months ago, a new Australian standard, it has a number 5369, and it was published in 2023, sort of December 2023. And it was replacing some previous standards, and it's all around what to do in your sterilizing room. To put it in very simple layman terms, how we run the steri, how we clean, how we dry, how we sterilize, how we record, how we document, and all those processes in there. So this particular standard replaced two previous ones. So now we have one standard to rule anyone or any facility that sterilizes and reuses instruments. So this applies to dental practices that reuse their instruments, podiatry, general medical, hospitals, day procedure units, anyone who wants to reuse their instruments. So they now follow, well, it's like the recommended reading under the Dental Board of Australia. This particular document is like, we strongly encourage. And you'd be foolish not to follow it. Now, what's interesting is on the 1st of September this year, in New South Wales, this particular document has now been put in legislation, which means that practitioners, and it specifies dental practitioners who reuse medical instruments or dental instruments, they are now required to follow AS 5369. So there's no ifs, ands, or buts. It's you will follow this. And that's been legislated in New South Wales, as I said, the 1st of September this year. Now, I don't know if any other states will follow suit. We shall see. But New South Wales has sort of gone, okay, for whatever reason, it's made it clear. It's like you will follow what's in this particular standard. So it tells you, how to clean, how to sterilize, how to record, all those bits and pieces. Yes.
And so given that it's in legislation now, and there's every chance that it certainly will roll out in other states of Australia, what does that mean in terms of how you manage your practice? Does that really put the onus on you to make sure all of your team members are completely over these new standards and the changes that have been made to them to make sure that you are fully compliant in the state of New South Wales?
It puts the onus on the dental practitioner, yes, or the person running the dental practice to be all over it. And unfortunately, the way the standards are written, it's not like bedtime reading. It does require
although for you it was.
Well, no, even for me it was not. It's one of these documents that you read and you reread, and then you read it and then it refers you to another section of the book and you read that and then you refer back to another section. They're not fabulously straightforward, which is a shame. So my role, what I see as my role or my duty, is to read it for you and help you interpret it for your practice setting. One thing this document talks about is risk assessment, and a lot of people hear that term a lot. It's bantered around, but what does it actually mean and how do I apply it? That's often where people get confused, and I completely get that. Because I must admit, I've done work health and safety certificate, I've done risk assessments, but even when I was reading it, I was like, okay, how do we do this simply and logically and not over the top, but in a safe way? Because you really want to make sure that your team and your patients are safe. Yeah. So what I guess the legislation has done is it's what people should have been doing already in New South Wales. It's now just made it a big, yes, you will definitely. While other people might have gone, oh, well, it's not really law and it's a guideline. And now it's like, well, there's no ifs, ands, or buts. And I've been working with my clients over the past 18 months and helping them get compliant to this standard, because it is a recommended reading by the dental board. And really, if you're not following it, what are you following? And you have to justify that if you're audited. And if I audit again for the dental board, that's what I would be following.
Yeah, that's it. So for people who aren't aware of the work that you do, Amalgamate Consulting is that it is going in there and making sure that all their practices are within the guidelines of infection control and what is advised. And you've been doing that for a number of years now, and you've gone into many, many practices and made sure that all the team members are properly trained in infection control. And I've spoken to you about this in the past. I know it's been a long time since I was last a dental assistant. So I was an assistant from maybe 1987, all the way through for, a good couple of decades after that. And then I've always worked in dental practices. I moved into reception and patient facilitation and practice ownership as well. But never at any of my practices that I worked in, or the one that I actually owned, was there ever an expert like yourself coming in and saying, let's make sure we're all doing the right thing here. And it ends up being one of the most important aspects of dental practice operation, is making sure that what's going on in that stereo room is compliant, but that all team members are properly trained in it. I think there's a bit of a methodology thinking, oh, we'll just get a trainee to come in and help with some stereo. But it requires far more awareness than that, and it needs to be right and consistent every single time. What's been your experience going into dental practices where you've got a collection of different people, they've all had different experiences at different practices, they don't have a common knowledge of what needs to happen, correct?
Correct. And often that's where conflicts arise, and everyone does something slightly different in the steri because they've brought it, in my practice, we didn't have that machine, we had this and we did it this way. And a common thread through a lot of the infection control training that I've done when I've gone into a practice is I really want everyone to be on the exact same page, because everyone's bringing in their different views. So I work with the practice to sort of say, okay, let's take you through the stereo room step by step. What are you doing? And is that ticking the right boxes? Because sometimes there's more than one way to do something correctly. But there are some non-negotiables in stereo. There are requirements now that certain tests have to be run in the autoclave before you use them, and recording all the instruments that go in and out of the room. That tracking has to be tight. And so we'll work with practices, and often I find they're not quite tracking that properly. So there's no accountability of who put the load in or who took the load out, and it's not documented somewhere. So we go through, are you a paper practice, or would you like to move to an electronic barcode scanning system? And let's see what we can do there. But yes, getting everyone on the same page is the common thread. Like, Ros, please make sure we're all on the same page.
Yeah. And even just with staff changeovers, sometimes the person that kind of was the expert has since left the practice, and you haven't really considered then what everyone else is left doing. And I still remember, and I share this often with my clients that I go into, talking about how important it is for you to go in there and do a session with them, is that when you do get a team member from each of the practices in front of the whole group, show me how you do a particular thing, break down your surgery or set up your surgery or do a stereo process. a common or response to the rest of the team members is, oh, I don't do it that way, I do it this way. And so to get that one uniform way of doing things and then having it all documented in your SOPs and being aware of that in your onboarding of any new team member is just so crucially important, because that's where sometimes balls can be dropped.
Oh, very much so. Yeah, very much so. And one thing that I've started doing in my training is before I come into a practice, we always have a sort of a phone or online meeting to sort of nut out those areas that they'd like covered. And I'll often have some suggestions of, well, this is now some of the latest and greatest. We should also cover this. I ask them to take photographs of their steri room and then do a video of the journey of a dirty instrument from the end of the appointment as it arrives in steri and the process it goes through before it pops out the other end, as well as perhaps a changeover clean or anything like that. So I look at all that before I come. So I get a good idea of what's already happening, what materials or equipment and all that sort of thing. So I can sort of tailor my training. And after sort of I do the steri room section, I suppose, of the training, I'll play that video to everyone, and that's when everyone often chimes in and goes, oh, I definitely don't do it that way, because that way you can see what's happening. And I'm so aware that if you're videoed, it's so nerve-wracking, and people will drop things or they rip their gloves putting them on, and that's completely fine. It's all just part of this in-house learning. And I always try to give the person who was videoed a nice little present afterwards to, say thank you, because it is so, it's like, oh. But then I've had some DAs who are like, oh, I will do that. I love being on camera. So it's cool.
Their moment to shine. I love it.
Their moment to shine. They love that. Yes, yes. So, so the training is teaching or putting out there what's the latest. Steri is the biggest change. Also offer a chance for me to confidentially do an audit, which is when the practice is operational. I can quietly move around with my little checklist on my phone and watch and observe. And that's nerve-wracking as well. I was in a practice recently and the dentist was like, I was just sort of quietly looking through the door as he was working, just trying to see, were they wearing, how was their PPE, how was their chairside manner, aseptic technique and all that sort of stuff. And he said he started to sweat like he was back at uni in exams. Poor guy. So I know what it's, I know what it's like. I still remember that happening when I was a student.
Those days.
Oh, yeah. Empathy galore. Completely understand.
I was having a conversation recently with someone who said they'd gone through the accreditation process.
Mm-hmm.
And now that these new standards are in place, I don't know if this is just in New South Wales or if this would be Australia-wide, that they no longer meet that accreditation. And even though their full year isn't up yet, before they'd have to do accreditation again, they're no longer considered accredited because there has been that change.
Really?
Yeah. I don't know if that was just a one-off or...
Is this, all right, perhaps if I can clarify, was this accreditation through the Australian Commission for Safety and Quality in Healthcare? So the ADA doesn't accredit dental practices.
Mm-hmm.
It's through the Australian Commission appoints a number of businesses who are like or auditing, who can then audit you and give you an accreditation sticker. And there's two of them, to my knowledge, at the moment in Australia, because the standards for becoming accredited have changed. Mm-hmm. And the new standards say you definitely have to follow AS 5369. So it's actually in that if you want to become accredited, which is why you should do it anyway, regardless if you're accredited or not, or New South Wales or not. But I didn't realize that if they've been accredited for like a 2-year period, I would have thought they'd still be accredited until they had to renew, and then they might have to prove accreditation to the new set of standards and AS 5369. But I am not quite in that accreditation world anymore, seeing as I'm not doing accreditation with practices anymore. I'm just concentrating on infection control support.
Lovely. So with these new standards, what are some of the changes that might surprise people or that they should really be aware of that come to your mind straight away?
So probably a couple of things that come to mind is the documentation, like recording what you've done in the steri. It's very clear on recording if you do testing of the ultrasonic cleaner, though that hasn't changed. That was required before. The testing for your autoclave, particularly around what we used to call the helix Boedic test. There's been a little change of terms, and the actual little, I'll say helix in inverted commas, device that we put in now needs to be made to a slightly higher standard. But a lot of the dental companies are still selling the old device, which is wrong of them, but they are. So it's a matter of just saying often I'll sort of say, look, that one's out of date, and the new helix device, you've got a couple of choices, and here they are. And these ones are now compliant. So that is new. Recording who loads, who unloads, and actually what's in the load. A bit more information about what actually goes in. What else is new?
Just coming back to that helix test for a moment, the one that you've now got in inverted commas helix test. So if someone wants to make sure that they have got the most current one and there's a couple of options, what do they ring their company and ask for?
What they have to ask for is, was the device made to? So instead of an Australian standard, it's made to an international standard. So they call them ISO standards. And the number you want is 11140-6. So what you want is that little number to be on the outside of the box of the device and written on the plastic device itself. So for example, here's one I have prepared.
The one I prepared earlier. Lovely.
It looks like looks very similar, doesn't it? It's got a coil and it's got a bit that uncovers and it's got a little strip.
Mm-hmm.
When you unfold it looks very familiar. This is where you need nails and then you're not allowed to have nails. One of those.
Yeah.
So, but the whole thing's just been made to a new standard. So what you need to do is buy something, and they're required to have that number, ISO 11140-6, actually written on the device now.
Okay. And so is that still called a helix device?
It's actually called an air removal and steam penetration test.
Beautiful.
But most people will probably still say
it's a helix.
Helix.
That helixy thing.
The snail helixy thing, yeah. Air removal steam penetration test is a bit of a mouthful.
Yeah.
Well, it does explain what it does, and I go into like how these actually work. When you explain how they work, everyone goes, oh, and I remember when I first learned, I went, oh, that makes sense.
Very good. Very good.
Yes.
And so are there other substantial changes that people need to be aware of?
They're very specific on doing a risk assessment for your steri. So basically, you need to create or get help to create a little spreadsheet, and you basically put together one of these official risk assessment documents. So it basically means that each step in the steri process, from arrival to cleaning to drying, what are the risks of injuring yourself or transmitting an infection, or how are you going to manage that? So there are things that we think about already, but we just actually need to put it down in writing, and that's something that they require you to do. So that's something I've helped practices with, because I've just got what I hope is a simple but comprehensive spreadsheet, but something that's very hopefully in everyday terms with maybe a smidgen of official terms in there to sort of say how they manage it. Example, They're very big on transferring your dirty instruments to the sterilizing area, or we'll call it steri room, safely.
Mhm.
So, do you walk down the hallway with an uncovered tray of dirty instruments, or do you put a lid on it, or do you put it in a transfer box, or do you put it in bigger boxes into a cart and you wheel them down a hallway? So, you basically just go, okay, what is the chance of me when we transfer our dirty instruments? One, I'm going to run into a patient. Two, I'm going to drop something on my feet. I'm going to run into another member. So, you look at that risk and you decide in your practice what is the best way to manage that. So that's you assessing the risk in your practice. So
Yeah.
it's not necessarily you will do it this way. There's often a number of ways to, how to manage or control that risk. Yeah, to make it hopefully disappear completely or reduce down so low that you're not going to, the worry is, or the risk is so low.
Yeah.
Yeah.
And, I know that you provide a lot of assistance to companies that help fit out dental surgeries, just in the design of their steri rooms, because when you're talking about risk assessment, the design of some of these rooms and fit outs in dental practices from decades ago, just because of their mere structure, the risk is higher.
Oh, that's exactly right. And the AS 5369 is very clear on the design as well as how you should ventilate it and how you should keep the temperature, not too hot, not too cold, and all that, as well as how it's all laid out to make it safer. So you've been into practices where, you might have one autoclave at one end, but another autoclave at the other end because they needed two, but they couldn't put them side by side. And staff, instead of going in and just on a nice little conveyor belt walking and coming out, they're back and forth and they're higgledy-piggledies. Yes. So it's quite clear on that. And I've luckily had the input with more than a couple of practices who are renovating or building, and they've said, just cast your eye over the design. How are we going for compliance? And if they decide it's often better, well, how many drawer spaces do you need, or cupboards or counter, or how high should the cupboards be, or how big should the sink be? It's also where you put all the equipment. I'm a bit terrible for anytime any of the dental companies post, new photos. We've renovated, we've built. Oh, I hone into the steri room and I screenshot the photos and I have a little collection. Because it's good to sort of see there's elements that are often really good, but I've often seen ones that aren't up to scratch because the people who do the building and designing also need to keep up to date with the standard here, as well as the Australasian Health Facility Guidelines. I hope I said that right. So there's information out there. But yeah, fingers crossed.
Well, you certainly, if anybody is going through a refurb or a build from scratch, to get your opinion on that's only going to assist them making sure that things are as compliant as they could be and as low risk as possible as well. So if there are dental practices that think, yeah, we're going to take this opportunity with this new updated version of the Australian standards, the 5369 2023,
Well done.
especially if I'm in New South Wales, and also if I'm going to be accredited, but also just because I'm a general dental practice and I want to be responsible, and they think getting you in is the best next step, which I certainly agree with. What does the process look like for them?
The first thing that I would suggest they do is they can jump onto my Amalgamate website. And I do have quite a bit of information on there about auditing, about training, and about SOPs that I can help them write. So they could probably just have a little general browse. But sometimes it's easier just to speak to someone. So they are most welcome to go to the contact page and make an appointment to see me either via phone or online. Give me a ring. I'm more than happy to have a discussion. What are they after? What are they needing? And then from that, I can sort of make some suggestions. I find what's quite popular is if I spend a day in a practice, the morning the practice operates as normal, and I would do an infection control audit. And I have to allow a good 4 hours because I'll go everywhere in the practice as unobtrusively and quietly, often very aware that you're seeing patients. So I won't always just pop into rooms when patients are being treated. I have to make sure the patient's okay, the practitioner's okay. I spend a lot of time in Steri. I ask to look at all sorts of records from your autoclave servicing validation records to all sorts of other records that you keep. And then at the end of that, there's usually a lunch break, and I might have a chat with the practice manager or the owner, just an informal what I found, because later on they'll get an actual written report. And then in the afternoon, generally they close the practice and then we have our training. And then I can hone in on what I've seen as well as what they would like me to talk about and get, everyone hopefully, all right, this is the latest and greatest. You're doing this fantastic. We might just look at tweaking and improving this section, and we need to add a little bit here. So that's what I call my complete compliance day. But there's follow-up afterwards as well, because quite often you'll get a report and then we need to have a chat about it, and people often need clarification on, well, what do I do first? Though my report, I try to pop in such a way there's like, you will need to do this now. And then the report will go, okay, in the next month, do this. And then we've got a little bit of time, start thinking about this. And try to put it in a very logical manner. All the while, I'm very aware of people have, there's time, there's cost to sort of factor in, but I try to, really bring forth okay, this is the most important thing and we really need to fix, and this is how you can do it. And give them the information or give them the document or however they need to do that.
And I imagine it's all done in a very non-judgmental way.
Very much so, because that's why you've called me in, is because you want to know where everything is, and very much so. Yeah, very much
Nice.
so.
And you are based in Perth, but this is Australia-wide that you can help
I'm
people
more
out.
than happy to travel, yes, Australia-wide. But I also now have Rochelle Fisher from Dental Assisting and Beyond. She has come on board under Amalgamate Consulting's umbrella to run infection control training, and I think before too long she'll also branch out into some auditing. And Rochelle is based in Melbourne. So there's a bit of a choice now between West and East Coast. You can have one of us. So if you have a preference for Rochelle or over me, or me over Rochelle, that's completely fine. But I think it's lovely that we're both in opposite sides of the country. So there's a little bit of choice there. But yes, she's very happy to travel. She just went to Wellington, New Zealand to run an infection control workshop for Amalgamate Consulting. And yeah, she loves to travel as well. And she's an absolute pocket rocket dynamo who's probably even more pedantic than I am.
You certainly got a couple of detail-oriented people involved.
Oh, very. But Rochelle, being a UK trained dental nurse with years of experience and a lot of surgical as well, but also trained dental nurses beautifully. Because she can teach four-handed dentistry, which will help with people's infection control. So, yes, it's a very exciting collaboration that we have launched. Gosh, when did we launch it? 2 months ago?
Yeah, it was relatively
About that,
recent.
yeah, 2 months ago, which is going really well. And she learns from me, and I of course learn from her, and then because you never stop learning, do you, Julie?
You never stop
Never stop
learning, that's for
learning.
sure. The can-I journey, constant and never-ending improvement. Now, you've also got the Academy, which I think is just such an amazing resource. Can you just tell us about that for a couple of minutes as well before we sign off?
Oh, yes, thanks, Julie. So sometimes me visiting in person or doing an audit is probably not quite what a practice might be after. So I have an infection control online learning academy. And what that means is a practice can sign up themselves and all their staff. The number is pretty much unlimited, though if you're over 20, we'll work out a bit more of it'll be a small cost admin fee for me to actually get everyone joined up. So in the online academy, every person who's signed up gets a login to the dashboard, and you access it through my website. So you just log on to amalgamate.com.au, and then there's a login button on the top right. You go into your own personal dashboard. Now, in that, there are 2 3-hour online infection control courses. One is a beginner level, one is then an intermediate level. And it takes you through a series of videos and teachings, and you listen to me and you answer some quiz questions. And at the end, it gives you a certificate of completion. So this is one way practices can get infection control training for their staff in a slightly easier way. Perhaps they can do it during time at work when they get off, or however you want to arrange that. I also have a lot of resources on there, from record sheets for autoclaves and things like that. Plus, I have some monthly webinars where I try to find out what the latest hot topic is and have a bit of a chat and sort of educate about that, and some speakers. So that's always available. Your membership is for 3 months at a time. So I've had some practices join for 6 months, and then they've put all their staff through it, and then they said, oh, well, we'll stop our subscription now, but we'll join again next year when we have new staff. Or some practices have had a rolling subscription, because anytime they get a new staff member, before they start at the practice, they say, please do Ros's beginner and intermediate course as part of your onboarding induction program. Yes, and then hopefully when I have a bit of time, I'm going to put together the advanced infection control course on there, covering more in-depth stuff, particularly what's coming from AS 5369.
That is terrific. And, you know, it's good for the reception team, the admin team, to be able to do it as well. Because when we are talking about people walking up and down hallways with trays of dirty instruments and possibly helping out in stereo every now and again when everyone's under the pump, to have everyone aware of what is going on, what the minimum standard is there, and how we do things here is enormously important. And what a wonderful step in an induction program for new team members. Wonderful.
Yes. Well, the idea is to try to take a bit of the pressure off a practice for having to do it. If it's done for you. A lot of practices go, oh, thank you, Ros. That is so easy. Yeah, my pleasure.
Well, that is absolutely terrific, Ros. And we certainly do encourage all dental practices, if you haven't done any infection control training with your team for a long time, or ever, now is absolutely the time. Let's make sure everyone is compliant. And the outcomes are going to be your whole team doing a consistently minimum standard of infection control in your practice that you can sit back and have faith in, and all of your patients can actually enjoy as well. But it's also protecting not just the patients, obviously. It's making sure that all the team members are safely working together as well. And it's just such a straightforward thing. Go straight into the academy and also get Ros out for a one day, and you're getting all your bases covered. So amalgamateconsulting.com.au is the website. They can reach out today, get that ball rolling. Thank you, Ros.
Thank you, Julie. I appreciate being able to talk about my passion.
I love it. We all got to be passionate about something, and you're about
We do. Well, that's one of my passions.
Well done. Thank you, Ros, and we'll speak to you next time.
Thank you, Julie. Bye.
If you enjoyed this podcast, then I encourage you to head over to Amina and my website, dentalbusinessmastery.com.au. You will find all the information that you need if you would like to gain our assistance in helping you and your team achieve great success. If you would like to find out more, you can also email us directly at info@dentalbusinessmastery.com.au. Thanks so much for listening.